My name is Emmanuel Cruz Carrasco. I'm going to read chapters 20, the gastrointestinal system, and chapter 21, gynecology of the textbook Professional English Use in Medicine. Chapter 20, the gastrointestinal system. A. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note if the abdomen is distended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting dullness. Percuss or tap first with the patient lying supine, flat on their back, then ask the patient to lie on one side and percuss again. If fluid is present, the dull note heard on percussion moves. Palpate each region, feeling for tenderness, pain when touched, or masses, palpable enlargement of tissue. Note also any guarding or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpated hand is suddenly removed. It is a sign of peritonitis. Listen for vowel sounds. B. The fishes. There are several words for the fishes. Doctors sometimes say there was blood in the stools. Have you passed black stools? Patients sometimes say my motions have been very loose lately. Bowel movement is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hard infrequent stools, or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid or form. The consistency or degree of hardness and softness can be shown on a scale. The scale is hard, form, semi-form, soft, loose, and last, liquid/watery. The color can vary from black due to altered blood as in melena to yellow, gray, or even white. Melena stools are often described as tarry, like tar, the black sticky substance that is used in road making. The stools may be red when fresh blood is present. Blood that can only be detected with special tests is called fecal occult blood, FOB. When there is a high fat content, the stools are pale and are sometimes described as clay color. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Now I'm going to read the exercises of chapter 20, the gastrointestinal system. 20.1. Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius, pulse 100 per minute. The pulse was 100 per minute, blood pressure 110 above 80. Examination of the rest of the cardiovascular and respiratory systems was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant and was associated with guarding but not rigidity. There was no rebound tenderness and no masses were felt. Bowel sounds were deduced. 20.2. Match the descriptions of the stools 1 through 6 with the conditions most likely to cause them. A through F using your medical knowledge. Look at the opposite to help you. The type of stool number 1, these are bloody, loose and bloody stools, is associated with the condition of ulcerative colitis. The number 2 type of stools, loose, pale, and bulky stools, is associated with the condition of irritable bowel syndrome. The third type of stools, these are clay colored stools, is associated with the condition of obstructive jaundice. The fourth type of stools, these are black tarry stools is associated with the condition of gastric ulcer. The fifth type of stools, these are small hard stools, is associated with the condition of celiac disease. The sixth and last type of stools, these are clear, watery with mucus stools, is associated with the condition of cholera. The 20.3 match the features 1 through 7 to the doctor's questions A through G. Look at the opposite to help you. Now I'm going to say the questions and the features. How you pass black stools? The feature is blood. How often do you open your bowels? The feature is bowel habit. Are you going to the toilet more often than normal? The feature is change in bowel habit. Is the size or the amount of the stool normal? The feature is bulk. What about the appearance of the stools? The feature is color. Are the motions hard or loose? The feature is consistency. Do the motions have unusual smell? The feature is offensiveness. Now I'm going to read the divisions of the abdomen in quadrants. We have a picture of the divisions. We have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. I'm going to begin again, sorry. Right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. The abdomen can be divided into these 4 quadrants. Here is the picture of the quadrants of the abdomen. I am going to repeat them for one last time so we can clarify this. We have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So that was chapter 20, the gastrointestinal system. Now to chapter 21, gynecology. Chapter 21, gynecology. A, the female reproductive system. Here we have a picture of or illustration of the female reproductive system. We have the womb, the ovary, the neck of womb or cervix, the fallopian tube or salpinx, and the vagina. B, menstruation. A period is the common name for a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor notes LMP. 52 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 4 about 28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, menorrhagia, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea, or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of menopause include hot flushes, sudden sensation of heat, and night sweats. C. A gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist. Are your periods regular? Patient. Yes. Gynecologist. How often do you get them? Patient. Every 4 weeks. Gynecologist. How old were you when you started to get them? Patient. About 12. Gynecologist. When was your last period? Patient. A week ago. Gynecologist. How long do the periods last usually? Patient. 4 or 5 days. Gynecologist. Would you say they are light or heavy? Patient. Light. Gynecologist. Do you get clots? Clots. Patient. No. Gynecologist. Do you get period pains? Patient. Not really. Gynecologist. Is there any discharge between the periods? Patient. A little. Gynecologist. What color is it? Patient. White. D. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women. I'm going to read the exercises of Chapter 21, Gynecology. 21.1. Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. 1. Hysterectomy. Surgical removal of the uterus and cervix. 2. Menorrhaea. This is heavy flow. 3. Salpingitis. Fallopian tube inflammation. 4. Cervical biopsy. Diagnostic exam of the cervix. 21.2. Read the conversation between the gynecologist and the patient is the opposite and complete the notes about the patient. Menarche, 12 years old. Menstrual cycle, 4 or 5, about 28. LMP or last menstrual period, 28 ago. Menorrhea, no. Dysmenorrhea, no. Discharge, a little, white. 21.3. Now write the questions that the doctor asked. Look at the opposite to help you. Menarche, how old were you when you started to get them? Menstrual cycle, how often do you get them? LMP or last menstrual period, when was your last period? Menorrhagia. Will you say they are light or heavy? Dysmenorrhea. Do you get period pains? Discharge. Is there any discharge between the periods? 21.4. Complete the case report. One word is needed twice. Look at B and C opposite to help you. Case 15. A 45-year-old woman had been having heavy periods lasting for 8 days, with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her period pains were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously when a copper coil was fitted. She had had a normal pregnancy when she was 25. Now you had illustration of the different contraception methods for women. Here we have the diaphragm, the IUD or intrauterine device, condoms, and the copper coil. So those were chapter 20, the gastrointestinal system, and chapter 21, gynecology, theory and exercises of the textbook Professional English Use in Medicine. Thank you very much for watching this video. My name is Emanuel Cruz Carrasco. So that was the video.